Since the beginning of the semester, VCU has had a total of 4 possible cases of H1N1 flu. Despite the global media emphasis on the spread of the virus, some students say they're not concerned.
It's just like any other flu. I mean, you take your medicine and you're fine.
I think if you take care of your body and you do well to keep your immune system going, you'll be fine. But just to get that extra, immunization in is always a good thing.
Regardless of student opinions, VCU officials say they want to educate students on the severity of the virus.
We do want to educate people a lot about H1N1, how to prevent it, what to do if you become sick. So a lot of attention is needed, but we also don't want to alarm people. We don't want them to become extremely frightened about it, but it is important to be cautious and prudent about the infection.
According to Robertson, most of the strains of the flu circulating right now are H1N1. However, student health services do not directly test for the virus.
We do a test that's done in most physicians' offices. It's a rapid test, and we can tell them within around 5 or 10 minutes if they tested for positive for influenza A. Since H1N1 is the virus that's circulating everywhere, we presume that it's probably H1N1 if they test positive.
According to Robertson, VCU Health Services will be conducting media campaigns through the VCU homepage and portal, as well as the Stall Street Journal, in an effort to educate students about how to prevent infection and what to do if you are infected.
You want to be sure you wash your hands. If you sneeze or cough, do it into a tissue or into the elbow if you don't have a tissue available, and dispose of the dirty tissues appropriately.
The CDC recommends people who are infected to stay home until you are without a fever for 24 hours without the use of medication.
If they are at a risk for complications from influenza, or they're having more severe illness where they're having shortness of breath or chest pain, then we want them to call either us or the healthcare provider so we can decide if they need to be seen.
While only 4 cases have been reported at VCU so far, Robertson expects to see more.
I'm sure we'll get more cases just because it's so widespread throughout the United States, and because the seasonal flu season will be starting probably in October. So we'll be seeing flu, whether it's H1N1 or seasonal flu.